Hi, I'm Dr. Kynaston-Pearson and welcome to this short video on medical ultrasound. Well, this is an example of a medical ultrasound machine. As the name implies, what it does is use sound waves at a very high frequency to produce images of the body. The probe pushes very high frequency sound waves out, they bounce back into the probe where they're detected, and some very clever technology uses those bounce back sound waves to produce images and pictures of the tissues of the body. Medical ultrasound is very helpful, but it isn't necessary in every case. Many patients who are coming in with conditions in the field of rheumatology do not get a great benefit or do not need medical ultrasound to help with their diagnosis. However, it is a very helpful technology, especially when you're thinking about inflammatory conditions and inflammation in the joints. Medical ultrasound can pick up subtle changes inside the joints or changes in blood flow that suggest inflammation at a very early stage, and it can be a really helpful addition to examination to pick up early inflammatory conditions when they're still not clinically so apparent on examination. Well, the first thing that might happen is that you've seen me in clinic and I've recommended that you come back for another assessment where we can scan a specific area like the hands and wrists. In the new consultation, although we have a 40-minute appointment, it's difficult to properly assess the joints with the amount of time and attention that is needed. So I recommend coming back for a follow-up with the use of ultrasound to assist the examination. It takes around 20 minutes to do a hand and wrist examination of both sides, a similar amount of time if we're doing feet and ankles. If we wanted to do both, we might be better off with a 40-minute appointment to make sure we image everything adequately, to make sure we're not missing low levels of inflammation. If you're confident that you want to have ultrasound as part of your assessment, I do offer a bundle for new patients where you can come in for a 60-minute appointment and we can use the ultrasound for, say, hands and wrists or targeted towards the most painful areas. And that saves you having to come back for a second appointment. Obviously, if you're not sure, the best thing is perhaps just to book the 40-minute review and I can let you know if I think ultrasound will be helpful. So this is how a medical ultrasound would be done for an example of the hand and wrist. The first thing is you need something to conduct the ultrasound waves nicely across into the joints. So you put on plenty of jelly over the wrist and the joints of the hand, and then the ultrasound is just put gently over the top of these joints, and then we scan up and down and scanning side to side across at the edges of the wrist as well, and then scanning across the knuckle joints and some of the smaller knuckle joints as well. We normally take pictures both with the normal image and an image I will show you in a moment that helps to pick up low levels of blood flow that's called Doppler. If you're looking at the screen now, you'll probably be able to see that there's some movement of these tendons at the top. So I've got the ultrasound probe at a wrist joint, and we can see inside of the wrist joint and we can see the tendons moving there as you're wiggling your fingers. So we can see that we get quite a good picture inside the joints this way, and this is an example of looking at the wrist joint. Right at the bottom you can see all the bones of the wrist, and over the top, which you can see now moving, are all the tendons. If there's a lot of change, we may see some puffiness or change to the colour, the grey colour of that tissue just under those tendons that are moving. We can also put this little box on, and that little box can pick up very low levels of blood flow which might suggest inflammation. So you can see it's incredibly sensitive. All those little dots from moving the probe. If we had a bit of movement here, that might suggest there is a little bit of inflammation. And just to show you an example, if I put it over here, you can see that there is a blood vessel. So it can very easily pick up flow when it's going over a blood vessel, but a very small amount of flow in the wrist joint or in the joints of your finger, like this joint here, which is your knuckles, might suggest that you have a little bit of inflammation. So that's how medical ultrasound can assist with an examination, by actually looking inside of the tissues and getting a better look than we can get just from the clinical examination alone.